Hello everyone, today I'll be presenting on hypothyroidism, an endocrine disorder that affects millions worldwide. I'll cover its definition, prevalence, symptoms, pathophysiology, diagnosis, treatment, and the long-term outlook. By the end, you should have a clear understanding on how hypothyroidism is identified, managed, and why it's important to recognize early. Hypothyroidism occurs when the thyroid gland produces insufficient thyroid hormones, primarily thyroxine or T4 or triiodothyronine or T3. These hormones are critical for regulating metabolism, growth, and energy production. When they're low, the entire body slows down, affecting almost every organ system. In the United States, hypothyroidism affects about 5% of the population, with subclinical hypothyroidism found in up to 10%. Women are affected 5 to 8 times more often than men, and the risk increases with age, particularly in people over 60. Because symptoms are often subtle or mistaken for other conditions, many cases remain undiagnosed. Hypothyroidism matters because untreated cases can lead to serious complications like myxedema, coma, a rare life-threatening condition. It also impacts the quality of life, causing fatigue, depression, and cognitive decline. In women, it can also contribute to infertility. From a public health standpoint, it carries a significant financial burden due to ongoing treatment and monitoring. Symptoms develop slowly and may go undiagnosed for months or even years. Common ones include fatigue, weight gain, despite no dietary changes, cold intolerance, dry skin, constipation, and depression. On physical exam, you may see a puffy face, bradycardia, thinning of hair, slowed reflexes. Because these symptoms are nonspecific, hypothyroidism can be tricky to detect without lab testing. Hypothyroidism shares symptoms with many conditions. Depression can cause fatigue and low mood. Anemia may cause weakness and pallor. Menopause can bring weight changes and mood swings. What makes hypothyroidism unique is its combination of systemic symptoms plus objective findings like a goiter and lab evidence of high TSH with low free T4. The thyroid is a butterfly-shaped gland in the neck, just below the larynx. It produces T4, which is converted into T3, the biologically active form. Its activity is regulated by the hypothalamic pituitary thyroid axis, where the pituitary releases TSH to stimulate hormone production. In primary hypothyroidism, the thyroid itself is impaired, which is most often due to autoimmune damage from Hashimoto's thyroiditis. Secondary hypothyroidism occurs when the pituitary fails to produce enough TSH. At the cellular level, reduced thyroid hormone decreases mitochondrial activity and slows protein synthesis, leading to the sluggish metabolic state patients can experience. Diagnosis is confirmed by blood work. The classic pattern is elevated TSH with low free T4 in primary hypothyroidism. Subclinical hypothyroidism shows elevated TSH with normal T4 levels. Checking thyroid peroxidase antibodies help identify autoimmune causes like Hashimoto's. So aside from your regular lab test, ultrasound can assess the size, texture, it can detect nodules or evaluate the goiter. In certain cases, a radioactive iodine uptake scan helps distinguish hypothyroidism from other thyroid disorders, though it's not routinely needed. So the gold standard treatment is levothyroxine, a synthetic T4 that converts into T3 as needed. It's taken daily, usually for life, and dosing is adjusted based on weight, age, and the individual's lab results. It must be taken on an empty stomach to ensure the proper absorption is happening. So after starting or changing the dose, TSH should be rechecked every 6 to 8 weeks until stable. replacement can lead to atrial fibrillation and bone loss, so the goal is to keep the levels in normal range, not simply to suppress symptoms. So these emerging therapies, some patients report persistent symptoms despite normal lab results, leading to interest in combination therapy with T3 and T4. Another alternative is desiccated thyroid extract from animal sources through dosing can be unpredictable. Researchers are also studying rare cases in thyroid hormone resistance. Lifestyle plays a supporting role. Adequate iodine is essential, but too much can worsen autoimmune thyroid disease. Selenium and zinc support thyroid function. Certain foods and medications, such as soy, high-fiber diets, calcium supplements, and iron, can interfere with medication absorption if taken too close to the levothyroxine. So with proper treatment, patients can expect a normal life expectancy and resolution of most symptoms. If untreated, complications can include infertility, cardiovascular disease, and myxedema. In pregnant women, uncontrolled hypothyroidism increases the risk of developmental delays for the baby. So, improved screening, especially in elderly populations and during pregnancy, is leading to earlier detection. However, the rise in autoimmune diseases is contributing to a steady increase in cases worldwide. So our take-home message is that hypothyroidism is common, it is subtle, and easily mistaken for other conditions. Early recognition and consistent treatment can make a huge difference. Patient education about the proper medication use and follow-up is critical for long-term health. So here are my references. This information in this presentation is supported by these peer-reviewed articles, research, clinical guidelines, and authoritative sources as listed here in APA format. Thank you.